Tooth and gum diseases are not just today's diseases as it is thought. Scientific and archaeological researches show that dental and gingival diseases have been seen throughout history, and people suffer from these diseases a lot. Since common items such as toothpaste, toothbrush and antibiotics were not invented yet, dental caries was very common among people in general. Especially after the agricultural revolution, dental caries increased incredibly as people increased their consumption of flour and sugar. It is known that people who suffer from toothache due to tooth decay, gouging their teeth with primitive methods and try to relieve the pain. In later times, it is a well-known fact today that people from other professions such as barbers and farriers pull out the teeth of people suffering from toothache with various tools and put plant extracts, which are believed to be healing, on the wound. Most of the time, due to faulty tooth extraction, root fracture, tooth decay could not heal, spread to the surrounding tissues, cause an infection covering the entire jaw and cause many other complications, including death. In general, toothlessness at a very young age, losing most of the main teeth and especially the molars, was a common occurrence. For this reason, although primitive dentures and jaws were developed in Europe, they could not be used successfully. It has not been possible to develop an appropriate treatment method, since it is not known exactly what causes dental caries in general. As a result, the development of a treatment or prevention method can only be possible by knowing the causes. It is not possible to treat a disease or pathology whose cause is unknown or misunderstood. In ancient times, in some countries, it was sometimes possible to rinse the teeth with water after meals or to clean them with various bark. However, since such primitive measures could not completely remove the bacteria from the mouth, tooth and gum diseases were very common. Since antibiotics had not yet been invented, it was not possible to apply a rational treatment for infected teeth and gums. The treatment was generally based on the principle of carving the tooth and trying to remove the carious tissue with sharp objects or completely removing the tooth. After the rotten tooth was pulled or carved, herbs, spices and leaves of some trees thought to be medicinal were placed in that area. Relieving the pain was often very difficult. Therefore, it is a known fact that there are even people who commit suicide. Especially after the agricultural revolution, as people consumed more and more grain, flour and sugar, their dental health began to deteriorate. The processes of grinding, bleaching and refining flour and sugar were developed much later. Accordingly, as flour and sugar got smaller, tooth decay increased. Similarly, as fruits became more sugary than the old ones through selection, sugar exposure and related tooth and gum diseases increased. Over time, with the invention of antibiotics and the development of elements that provide oral hygiene such as toothpaste and toothbrush, tooth and gum diseases have also decreased.